नाशं दातारमीशं विविधौषधीनां धन्वन्तरिं रमानाथं सर्वरोगनिवारकम् आयुर्वेदप्रवक्तारं वन्दे पीयूषदायकं सर्वे जनाः सुखिनो भवन्तु सर्वे सन्तु निरामया सर्वे भद्राणि पश्यन्तु मा कश्चित् दुःखभाग् भवेत् ओम शांति 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 ही। सर आपका म्यूट है नितिन सर।
Now I request Shweta Shukla madam to please introduce today's speaker. Why नहीं?
नितिन सर कुछ प्रॉब्लम है क्या?
नहीं
मैडम इज वेटिंग।
नहीं श्वेता मैडम ने ज्वाइन किया है, बस उनको इंट्रोड्यूस करना है ना मैडम को।
I'm really sorry for the inconvenience. This is the first time we are facing this problem.
Nitin sir,
Yes madam.
my voice is clear, no?
Yes.
Shall we start? I think I'll
Yes, madam.
introduce myself with a small introduction. No formalities, please. We'll go right away.
Okay. So due to some technical issue, Dr. Shweta is having some problem at her end, technical problem. So Dr. Shweta, okay. So today our speaker is Professor ZENICA Madam. She is the professor and head Department of Kayachikitsa at Yenepoya Ayurveda Medical College at Karnataka. Yes, she has done her BMS from SDM Udupi and then MD from the Government College Mysore. She has done PhD also from SDM College Udupi. She has a lot of vast experience, and she has also been a part of our syllabus making committee and one of the active member after the chairman, co-chairman sir. She was the senior most, and she has contributed a lot in our this current new syllabus as per the CBDC. She has a lot of research papers for her credit, and she is in the part of the committee of the various at national and international level. Now I invite our today's speaker, Professor Zenica Madam, to please deliver her lecture. And this is the new topic, as it is the Samprapti Vighatana and the treatment protocol as per the Shadkriyakala is the new part in our syllabus incorporated this time. So this will be very helpful for all the scholars, for the teachers, and all for academicians. Thank you. Okay, Zenica Madam.
Yes, thank you very much, sir, for the introduction. And I should also thank Vishwa Ayurveda Parishad, the Kayachikitsa Sambhasha team for giving me this opportunity to take up this 1 hour through this webinar on the topic that is allotted to me. And I would also like to mention the intention behind the presentation of this topic. It is, as Dr. Nitin sir has just now told, the UG curriculum of Kayachikitsa has come up with the new curriculum and syllabus, and there are a lot of issues where new things have crept in, and there is also a requirement for many of the teachers as well as the students how to navigate through this new syllabus. So keeping that in mind, this presentation is mainly concentrated to the Kayachikitsa teachers as well as the students in UG as well as PG who are joining here, but mainly focused with the UG. How do we understand these applied aspects of the fundamentals that we have learned so far and give it a practical outlook? And this is the very reason for having this presentation here. And this is related to a very cream topic or a vital topic where we have an interconnection between the Samprapti with its Samprapti Vighatana and the Kriyakala being interwoven with each other. How do we make use of that in the understanding of diseases? So with that, I will just now share my screen and start the presentation. Is my screen visible? Can you please kindly confirm from the other end?
Yes, ma'am, it is visible.
Yes, madam. Yes, madam.
And it is in a slideshow mode, right?
Yes, ma'am.
Yeah. Okay, thank you for confirming. The topic that has been given to me is an approach to Samprapti Vighatana and the designing of the treatment algorithm with relationship to the Shadkriyakala. Now, all of us are very familiar through these terms. Every one of us know what Samprapti is, what Kriyakala is, what Samprapti Vighatana is, and what are those steps that are talked about in relation to Samprapti Vighatana as well. But all these years, the academics was with keeping Samprapti Vighatana as a separate topic in Kayachikitsa and keeping Shadkriyakala as a separate topic in Kayachikitsa, where we had, as all of us recall back in the non-CBDC curriculum, we had in the Kayachikitsa first paper, A part, the fundamental topics that are related with Chikitsa, the Maulika Siddhantas of Chikitsa, where each of these topics were dealt individually. And then from the B part of the first paper and then through the second paper of Kayachikitsa, we had the list of diseases according to the Srotas, and diseases were learned independently. Now, in the new curriculum, we see that these fundamentals are given an outlook of the applied aspect, and they have been integrated within the understanding of the individual diseases itself. So that's where the paradigm shift or the change lies. And keeping that in mind, I will make an attempt from my end to bridge this understanding of the Maulika Siddhantas or the fundamentals with that of the application-based area of the very same topic. And the objectives of my presentation here today is To discuss the relationship between the Samprapti and the Kriyakala, describe the role of the Shadkriyakala in Samprapti Vighatana, design the treatment algorithm with respect to Shadkriyakala, and of course, one or two examples to put in these fundamentals and talk about in the disease aspects. Now, the first question is that's partly answered right now with my introduction. That is whether there is any relationship between the Samprapti and the Kriyakala. All of us would agree with and tell yes, but then what is that relationship? If we are asked to explain, maybe for a minute or two, we would have required some time to integrate both of them and explain how the relationship is with both of these aspects. Now here I have put forth in this slide to simplify the relationship between the Samprapti and the Kriyakala. All of us are very much well acquainted with the Samprapti shloka from the Ashtangaradaya Nidanasthana that has been learned from our earlier education from Roganidana. Yata dushtena doshena yata cha anuvisarpataha nirvratti ramayasyasau sampraptir jatiragati. Now, what is so special about it? We have byhearted it, we have written in the exam, we have got marks, all that fine. Now, if we keenly break this shloka, there are three components in it. Yata dushtena doshena, yata cha anuvisarpataha, nirvratti ramayasyasu. So, understanding it in a applied manner, right from the Nidana Sevana and the Visheshan of the doshas, the process of the Samprapti starts. And this Samprapti, what is told in this definition here, if we try to relate it with the Kriyakala, the Shadkriyakala, what I'm talking about, or the Vyadi Kriyakala, the Vyadi Kriyakala can be split and related to these three components that are explained in the definition of the Samprapti. Dushtena doshena, so that marks the Sanchaya and the Prakopa stage of the Kriyakala. Yatacha anu visarpataha, once the Nidana Sevana and the dosha dushti has happened, these doshas, they go through the different processes of the Sanchayadi Shadkriyakala and they are in movement. Yatacha anu visarpataha. And the very characteristic movement where the doshas move from their Utpatti sthanas, Gauna sthanas, and then to the sthana of the Anya dosha marks the stage of Prasara, stage of the Kriyakala. Yatacha anu visarpata. There is a movement. Prasara is also related to movement. It talks about movement. So these three stages here, comingness, nirratir amayasya. So this marks the relationship between the sthana samshraya avastha, the vyakta avastha, and for that matter, even to incorporate the veda avastha. So this Shad Kriyakala, so the Vyadi Kriyakalas can be fragmented and connected to each stage or each step of the process that is happening through the Samprapti of any Vyadi. So we see that there is a one-to-one relation between these aspects. Therefore, Kriyakala is also considered to be the Samanya Samprapti for all diseases because it speaks about Atanka. Atanka is the Vyadi synonym here, the Atanka Samutpatti Krama. How a disease originates and manifests and proceeds through until it gets the name as a Vyadi. Now that we know there is a relationship between the Samprapti and the Kriyakala, then definitely or undoubtedly there should be a relationship between the Vighatana of that Samprapti to that of the Kriyakala. Now this slide here, I've tried to attempt in short what the relationship is. We have this very famous shloka that all Ayurvedists know it and we don't have any efforts to recall it. Dosha dosha samurchana. It is janito vyadihi. A vyadi is a conglomeration of the dosha and the dusha. The samurchana between the dosha and the dusha. So I don't have to explain more on this and everyone is aware of it. Then Indu commenting on Ashtanga Sangraha Nidana, second chapter, you find this line which is very much also familiar with other quotations. Sarvasyamapi chikitsayam samprapti vinashanameva pradhanam prayojanam. So we have also heard Samprapti Vighatanameva Chikitsa. The very same meaning, Samprapti Vinashanameva Pradhanam. So in the treatment of a disease, all treatments would speak of the Vighatana of the Samprapti or the Vinashana of the Samprapti. The chain of the Samprapti has to be broken if the disease has to be treated or if we have to give a cure to the disease. And if we go into Kriyakala, it is also called as, other than from the pathological sense that it is called as Atanka Samutpatti Krama, from the treatment sense it is called as Chikitsa Avasara or Karma Avasara, where Karma stands for Chikitsa. Chikitsa Avasara means the individual stage that is explained in the Shadkriyakala are the right time for the treatment by the guidelines that are given for the treatment in the respective stages of the Kriya Kala. So the right time to treat the disease is the Chikitsa, which is as equal to that of Samprapti Vinashana. Now, for our easy understanding for academic importance, we have been taught that if we need to achieve the Chikitsa, we have to understand the Samprapti, because the components of the Samprapti enlisted will help us to understand what should be the treatment further. That we call it as Samprapti Gatakas. Now, the list of the Samprapti Gatakas, what we tell to the student, are also much more elaborate than what I have put over here. But in short, in this figure, I have tried to put the most important Samprapti Gatakas because I want to make a note on each of these. Now, AMA, we know the role of AMA. I wouldn't go into the Roganidana aspects in this particular topic, understanding or taking into consideration that everyone is aware of, but just I would like to touch upon that what is connected to my topic. Now, the role of AMA, inevitably, all Ayurvedists would understand that most of the diseases would have the relationship of the Agni and the Utpatti of the Ama at different levels. And in the Samprapti Gataka, while studying about a particular disease, we try to unveil what is that Agni which is being involved, to what extent it is involved, does it require an attention in the treatment, and what is that Utpatti of the Ama that has been a resultant of this Agni Mandya state, and how do we treat this Ama which is associated with a dosha, what we call as a Sama dosha. Now, dosha's involvement, it is said to be that they have got a samavai sambandha with the vyadi. And these doshas, when we talk about, it is talked very superficial that the involvement of the doshas. But when we consider treatment aspects, there is a lot of depth that we have to understand. That is why in the classification of Samprapti, different types of Sampraptis are told, like Sankhya Samprapti, Vikalpa Samprapti, Vidhi Samprapti, Balakala Samprapti, and each of them, it is not like different Sampraptis. They are focusing on the analysis of the Samprapti at different angles, and the informations being incorporated in the disease. So when we study about the involvement of the doshas in the disease, of course, we superficially consider the involvement of Vata, Pitta and Kapha. But that wouldn't be sufficient to treat it right. That is why the description of Panchavayu, Panchapitta and Panchakapha is told. The sthanas of those respective Vata, Pitta, Kaphas are told, and the Karmukata or the karmas of those five Vata, Pitta, Kapha respectively are being told, so that when we understand it from a pathological sense and a treatment angle, we also need to know which dosha, which type of that dosha, in which sthana, and what guna karmas of that dosha are being affected in the disease process, so that we set it right by doing the proper Vigatana through our Kayachikitsa. Next is the dushya. We all understand that mala, dhatus, upadhatus, all these are termed as dushya when they are vitiated by the dosha, and they, in combination with the dosha, become the samurchana, and that gives an origin to the disease. So equally important is the consideration of handling the dushya while we attempt at a Samprapti Vighatana. So the treatment would have to stress upon the ama, the dosha, the dushya, as well as the srotas, and along with the srotas, the dushti prakara as well. And when we talk about srotas, from Charaka Vimanasthana, we have this very particular shloka, how the nidanas, which are aharascha, viharascha, syat dosha gunai samaha, that which have got similar properties to that of the doshas, would create even a dushti in the srotas, dhatubihi vigunais chapi srotasam cha pradushakaha. Now, dhatubihi vigunas chapi means that which is not viguna, but here the commentator clarifies that dhatubihi virodaha, that it will, the ahara and the vihara which will oppose the dhatus, and that which will add on to the doshas will even create a vitiation of the srotas. So these aspects are kept in mind when we do the sroto pradoshaja chikitsas. Now overall, all this is grounded upon a very pivot principle of Ayurveda, sarvada sarvabhava samanyam vradhikaranam rasaheshu etu visheshascha pravrati rubhyasya. I wouldn't explain this because the very shloka that is being studied from the Padartha Vijnana as a fundamental has its application throughout all the years of the learning and the application of it in the clinical practice for the lifetime of a Vaidya, where the understanding, literal understanding is very simple, but its application is at depth and vast, where samana dravya, samana guna, and samana karma yukta substances would add on, while if at all we want the reduction of an entity, the exact opposite would bring about the reduction. Now this particular fundamental, what I've put here in one of the disease example that I'll be taking up in the later part of my slides, I will touch upon this relationship there in the disease. Now coming to the treatment algorithm with respect to the Shadkriyakala, I have broken this Shadkriyakala into 3+3. Why? Because the Sanchaya, Prakopa and Prasara, we all know these are the stages of the Shadkriyakala, where the doshas would keep on moving from their swasthana to the Gaunasthanas, which is again the Swasthana in the Prakopa, and then in the Prasara to the Anya Dosha Sthana. And therefore, by virtue of this movement, continuous movement that happens in the vitiated doshas, these three stages of the Kriya Kala are called as the Paridavamana Kala. That means there is Davana or the movement of the doshas through these three stages. And whatever dosha related aspects that we learn that is happening through these three stages are called as the Paridavamana dosha Vishayas. That means the aspects that are related with the doshas that are on constant movement. Now, if we have to draw an algorithm, why I would like to draw your attention on this, because when we go into the individual diseases, we know that dosha samurchana janito vyadhi, that means from the fourth stage of the Kriya Kala, a disease is in the process where we can designate it as a vyadhi. But before that, it will not be called as a vyadhi, and what we get are only the dosha lakshanas. So this wouldn't identify very specifically what a disease is, but that doesn't mean that treatment is not possible. I would also bring to the attention of especially the graduates or the undergraduates here if you talk from a clinician's point of view, the reality is when a patient comes or approaches the Vaidya for a treatment, that would have already been in the 5th stage of the Kriyakala, or at least the 4th stage of the Kriyakala, if the individual has very keenly understood his or her body and understood the derangement in the form of some uneasiness, discomfort, and approach the doctor. Whereas the approach at the Sanchaya, Prakopa, and the Prasara stage of the Kriyakala to a Vaidya is very, very limited. And it doesn't, I would not say that it is not there at all, but it is very, very limited. And if at all it is approached, the Vaidya would have understood from the patient's history and examination the Lakshanas of the Sanchaya, Prakopa, and the Prasara, wherein the disease is yet to manifest, or the disease is yet to be labeled perhaps as a Vyadhi. Now, in this situation, whatever may be the disease, the treatment principles for the individual disease, for the Sanchaya, the Prakopa, and the Prasara stage of the Kriyakala would be the same all throughout. That is, during the Sanchaya stage of the Kriyakala, in a nutshell, we would tell that Chayakarana Dvesha. I would like to even elaborate on this further. In Prakopa, here in the algorithm, I've considered Shodhana Shamana. We would elaborate it in the next slide as well. And in the Prasara stage, Sthanivat Pratikaraha. So let's see in the slides to follow how we understand this algorithm that I have placed here. And this would be common irrespective of whatever the disease would be diagnosed in the later stage of the Kriyakala. Now, coming to Sanchaya, I am not going to talk about the definition of Sanchaya and all that elaborations and Lakshanas that we have already learned in the Roga Nidana. I am directly trying to connect with the Chikitsa part here. One more reason here why we need to learn about it. If we go into the Granthas, we have, it is of course Shushruta in the Sutrasthana in the 21st chapter, who has talked about the Shadkriyakala. And the Moola Shlokas have good amount of information on the Shadkriyakala process, while it is Dallana who comments on the treatment aspects in a very small informations through his Tika that we have to link and understand and apply it to the disease specific. Now, Chaya Karana Vidveshas Chaiti. This is not something where a doctor would write or a doctor would prescribe. It is the patient who will feel himself or herself. And it is by nature or by Swabhava that the person within himself as a part of healing would develop these type of lakshanas and develop an aversion to those nidanas that are responsible to initiate this samprapti or this kriyakala within the individual. Chayakarana Vidvesha, something that will add on to the increase will be having an aversion. I would like to take the example of Jwara because it is Ajanma Nidane Cheva. Almost everyone in a lifetime will have suffered from this condition, Jwara. When we have fever, or even before we have the proper labeling by the rising temperature, the uneasiness or the discomfort that will be happening in the initial stages of it, that is in the Sanchaya, Prakopa, Prasara Avastha, will make an individual feel not so good and would not, that person would not definitely like to have those items that will be Prakopana for the Utpatti of the Ama, and a dislike towards those substances which are Guru, Snigdha, Shita, and a liking towards warm and Lagu. So this is how where the body tries to initiate its Chayakarana Vidvesha. And this Chayakarana Vidvesha we study under a broad heading of Nidana Parivarjana. Nidana Parivarjana can be advised in the form of Patya by the bishop to the Rogi. It will also be initiated Swabhavataha by nature within the body himself, which we see in the Sanchaya stage of Kriyakala. But Dallana speaks, this is the first and foremost stage for the treatment. Madhya Karma Avasara. Sanchaye aparata dosha labantena uttaragatihi tetu uttarasu gatisu bhavantu balavattaraha. Now this is a call for early treatment, and the earlier the treatment, the better the prognosis is what we unanimously know. Doshapaharana, the doshas which are responsible to cause the disease, which form the samprapti, are to be removed. That means they have to be kept at check. And Dallana explains on this very same statement, Sanchaya Haparata, because if we allow it in the due course of time, it will, the pratikara, that means chikitsa. If at all we initiate the chikitsa in the early stage, alpatvam, it is the doshic extent is lesser and so it is easier, but if we allow it, pratikara bahulyam, it will increase and the treatment would become more and more complicated as it crosses through the different stages of the Kriyakala. Now coming to the Prakopa stage of Kriyakala, this is considered to be the Dvitiya Chikitsavasara, the second stage. And now, as I mentioned earlier, in one of the Samprapti Ghatakas would be the Ama, and that would associate with a dosha to form the Sama dosha in most of the disease condition. Of course, we do also have a set of Nirama Vyadhis as well, where in those conditions we skip or we wouldn't put our efforts in treating the Sama doshas and we directly go to the Nirama dosha handling. That part of it is also there, but most of our disease have an association with Ama. So like a majority, when we talk about disease treatments, we do touch upon Sama doshas with the involvement of Agni and Ama, also bearing in mind the exception category where Sama condition is not involved as well. Now, tesham apaharanam cha bahudosha shodhanam madhya doshe langana pachanam alpa doshe samshamanam iti. Now, the doshas which have undergone prakopa, which are usually in the Sama state of the doshas, are considered arbitrarily. It is an arbitrary consideration of a quantification, and depending upon that arbitrary quantification, it's appreciated by the clinical features we call as Bahudosha Lakshanas. We demarcate or classify a condition to be of Bahudosha or Madhyama dosha or Alpa dosha. And here in this context, Dallana tells us if the situation is of a Bahudosha, opt for Shodhana, likewise go for Langana Pachana, or if it is Alpa dosha, go for Samshamana. The same version is also available in Charaka Sutrasthana, where Langana Pachana, Doshava Sechana is mentioned. So they are in alignment with the informations that are explained by various acharyas. In total, to sum up with the treatment modalities in the Prakopa stage of the Kriyakala, what here in the Shadkriyakala, we see what is initiated in the previous stage of the Kriyakala as a Chikitsa would be continued in the next stages of Kriyakala as well. So, Pradvesho Vradhi Hetushu, that one, Nidana Parivarjana, which was talked about in the Sammati Rupa Vradhi Sanchaya, is carried out and followed throughout. Along with that, the Ama Dosha Chikitsa is initiated. Shodhana Shamana, which I just mentioned in the previous shloka, Patya Palana. And of course, as a concept of prevention is better than cure, because we also know the Rutu Kriyakala, where the Sanchaya and the Prakopa stages are the same. And when it goes to the third stage, it takes a turn. If it goes to Prashama, it comes back. If it goes to Prasara, it goes in a linear pattern, and then it goes to successively to the six stages. So I tell my students the Shadkriyakala is a linear fashion or a linear pattern, whereas the Rutu Kriyakala, it's a circle. It goes round and round in circle, and that's considered to be physiological. So keep it within the physiological limits. The Rutu Shodhana is advised, or the Rutu Kriyakala measures that are told are also to be considered as long as it is the Sanchaya and Prakopa stages. Now coming to the prasara stage of Kriyakala, here we have a little bit step up in the treatment. What is told in the prasara stage, if we understand the pathophysiology, this is the stage where the doshas, they move from their own sthanas into the anya dosha sthana. So here we have the concept or the fundamental of sthanika dosha and the agantu dosha. And Shushruta gives the shloka as to when one dosha goes into the sthana of the other, how do we have to handle it? Vayo pitta sthanagatasya pittavat pratikaraha, and likewise. And the same thing is strengthened by Dallana as well as Chakrapani in their tikas respectively. We have to give importance to the sthanika dosha here in the prasara stage of Kriyakala when the agantu dosha has invaded into the sthanika in the sthana of the dosha which is already present. Now this sounds theoretically, but it is not theoretically. I would give an example at this junction, though this concept is also followed in the later stages of the Kriyakala as well. If we go into Charaka Sutra Sthana 14th chapter, that is Veda Adhyaya, there is a classification of Snigdha Sveda and Ruksha Sveda. And in that context, Acharya tells, Amashe gate vate kafe pakvashe ashrite, Ruksha Purva Hitasveda Snigdha Purva Tataivacha. Now, if we try to understand the application of this context, I would give the example of Amavata, which is a situation where the Vata, whose actual sthana is said to be the Pakvashaya, will enter into the Kapha sthanas, that is the Amashaya and the Sandhis, which are the Pradhana sthanas and the Gauna sthana for the Kapha dosha. And this is a situation where Vata enters into the Kapha sthana as per the Samprapti of Amavata. And in the Chikitsa Sutra of Amavata, we have Ruksha Sveda Vidatavya Valuka Putakaistata. There is an indication in the disease specific to use Valuka Putaka as a part of Ruksha Svedana. Now that concept of that Chikitsa there mentioned in that disease specific aligns with this chapter of the Charaka Sutra 14, where it tells Ruksha Purva Hitasveda. Now, why that Ruksha Purva Hitasveda? It is because the Amashaya is the sthana and the sthanika dosha is strengthened during that treatment. So this is one practical example where I had to put across to how these fundamentals would align in the treatment area. In total, to sum up, in the prasara stage of the Kriyakala, we have the doshas that are getting vitiated. Tatra prasaram yavat doshanameva. So we are treating the doshas in the form of dosha pratyanika chikitsa, and there is the cause, the hetu pratyanika chikitsa in the form of nidana parivarjana. Lakshanas of the doshas have been manifested, so we have Lakshanika Chikitsa and Dosha Pratyanika Chikitsa. That is why we also have the chapters of Doshopakrama, where elaborately different Doshopakramas under the respective doshas are being mentioned. And until this stage of the Kriyakala, it is the doshas that are being handled. Tad anantaram vyadhi riti. After this, from the sthana samshaya avastha, it is the vyadhi that is going to be handled. That completes with the paridavamana avastha, and now it is, if at all the nidana sevana continues and the disease progresses through the Shadkriyakala, it will be the time of the sthana samshaya. Now, in the sthana samshaya avastha, we have this chikitsa algorithm, what I've put over here. Sthana samshaya avastha ubayasya cha, ubayasya chikitsa. Now, what is that ubayasya chikitsa? We'll be taking in the next following slides. In short, to tell, it is doshasya, dushyasya, ubayasya. The dosha as well as the dushya, both are to be considered in the sthana samshaya avastha. And in the Vyakta avastha, now there is no ambiguity of the disease as far as the Lakshanas are present. Therefore, it is called as Vyakta. It's a full-blown disease condition. Pravyakta Lakshanas are seen, and the Vyadhi Pratyanika Chikitsa what is mentioned in the individual diseases is applied at this stage of the Kriyakala. And of course, the Vedavastha, usually we would from a prognosis point of view, we would like the disease condition to revert back as early as possible, at least from the Vyaktavastha back, because if it crosses the Vyaktavastha and enters into the Vedavastha, we all know that it wouldn't be so favorable with its prognostic outcome. And in gross, as per the algorithm, though we attempt a treatment, there is a success rate of reversals, but overall, by and large, we consider this stage to be apratyanika or nishpratikriya. I'm audible, right?
Yes, madam. Yes, madam.
Yeah, okay. Thank you for the confirmation, because it is one-sided. I wanted a confirmation. I'll be proceeding further. Thank you for that. Now, the Sthana Samshaya Avastha, these are some of the things which we already know through the Kriya Kala. Now, what I wanted to highlight here, everyone knows these quotations, so I wouldn't go through them. Tamstan Vyadin Jayate. From here onwards, the condition gets the labeling as a Vyadi. And now we consider the treatment of not the doshas, but along with the doshas, the Vyadi as well. And this particular stage of the Kriya Kala is marked with the resultant outcome in the form of the manifestation of the Purva Rupa, where there could be a good number of chances, a fair number of chances, where the bishop can also, the Vaidya can approach the bishop at this stage, and the Purva Rupas are to be identified by the Vaidya, and the treatment may be initiated. Now, to sum up the Chikitsa in the Sthana Samshaya Avastha, as told earlier, here we have the dosha as well as the dushya, because prasrutanam punar doshanam, the moving doshas mark an end in their movement, because sroto vaigunyat yatra sangha sa sthana samshaya, where there is kavaigunya, there they stop, or they undergo a samurchana with the dushyas, and that is why the name of that particular stage is called as Sthana Samshaya. And we have the dosha and the dushya both to be treated as mentioned in the algorithm, dushyasya cha ubhayashritaha. Both will get the treatment. And the Purva Rupas will be the guide for us to identify the stage of the Kriya Kala. Next comes the Vyakta stage of the Kriya Kala, where maximum number of patients who approach to us in the clinical setup are at this stage of the Kriya Kala. And it is considered, compared to the previous stages of the disease diagnosis, this stage is more easy to diagnose, though keeping apart the ambiguity in diagnosing rare diseases, difficult diseases, by and large, considering the entire stages of the Kriya Kala, this stage of the Kriya Kala, it comes with its pravyakta lakshanas as the resultant outcome, and thereby the Vyadi can be diagnosed by the presence of its pravyakta lakshanas, or we also call it as Atma Rupa, or we also call it as Pratyatma Lakshana, that is the signature sign or a signature symptom to the particular disease. And with that guidelines, we proceed with the treatment in the Vyakta stage of the Kriya Kala. And in this stage of the Kriya Kala, to sum up, Atra Vyade Pratinikeva Chikitsa. Here, Dallana tells very clearly, Atra Vyade Pratinikeva Chikitsa. This is the time where we consider a Vyadi and start treating the Vyadi in itself by following the guidelines of the treatments and the Chikitsa Sutras, which are mentioned in the individual diseases through the chapters of the treatises. The application of the Vyadi Pratinika Chikitsa could be explained by the Samanya Chikitsas, there are Samanya Chikitsa Sutras, there are Vishesha Chikitsa Sutras, there is Avasthanusara Chikitsa, there is Doshanusara Chikitsa Sutras, and all these incorporations would be the components that we consider in the Vyaktavastha of the Vyadi for the Chikitsa. And the last one, though would not wish to go into, by circumstances for different reasons, the disease may also enter into the Veda stage of the Kriya Kala. Again, leaving out the theory, I would like to concentrate the aspects or draw your attention towards the aspect that is wanting for the treatment. Now, Veda in itself literally means a differentiation. So by now, in the context, because it is Vrana Prashna, chapter of Shishruta, until then it was Vrana Shofa, now it gets converted into a Vrana. And the entire appearance of it would be very much different from that of a Vrana Shofa. So Veda, it demarcates itself. But even in the case, this is about the Shalya Sampradaya, but even in the diseases that are related with the Kaya Sampradaya, like Jwaradi, Shishruta also takes into account not only the surgical diseases but also the medical disorders with their medical managements, and gives an example with the Jwaradi disorders. There is also a differentiation. Now, what is that differentiation? When we talk in medical conditions, the disease would enter into a stage of Upadrava, or it would enter into a stage of Dirgha Kalanu Banditva. There can be the manifestation of asadhya lakshanas. There can be the manifestation of udarka, arishta lakshanas, and even marana if not handled or may not be able to be handled. So all these changes will be happening in the Veda stage of the Kriya Kala. Therefore, tatra pratikriyamane asadhyatam upayanti. From a prognostic point of view, treatment is not that easy as the previous stages of the Kriya Kala. Still, how to handle this stage? In that situation, knowing the prognosis or the outcomes of the prognosis, there are situations where the Vaidya has to take into consideration the prognosis and may have to effectively communicate with the patient party, and explain about the situation or the prognostic outcome. But if there is an upadrava that is manifesting with the disease in the stage of the Kriya Kala, there is upadrava chikitsa guidelines, either Tvaramana chikitsa or Pradhana Prashama chikitsa. Tvaramana chikitsa means if the upadrava is of an acute emergency, an individual attention has to be given to the acute emergency which arises as a complication for the time being, sidelining the main disease. That is a Tvaramana chikitsa, which usually happens in the intensive care or the emergency units. And the other way around is the Pradhana Prashama chikitsa. If the upadrava is anu and it is not stula, we have this classification of anu upadrava and stula upadrava, which comes into the picture here, not detailing more into it. If it is an anu upadrava, Pradhana Prashama chikitsa, because upadrava is anubandha to the samprapti of the main vyadhi, the chikitsa that is given to the main vyadhi would also take into consideration or control the upadrava as well. This is when there is an anu upadrava. So identifying the strength of that upadrava, the bishop takes the decision whether Tvaramana chikitsa or Pradhana Prashama chikitsa is required or it is to be done. That means whether an emergency management of the complication or the management of the main disease is sufficient enough to take care of the complication. This, if I have to give with one or two examples, suppose if a person comes with a condition of a person who is already having tamakashvasa and comes with a condition of status asthmaticus, definitely it is Tvaramana chikitsa that is essential. And if at all it is, say for example, a person comes with a diabetic wound and there is uncontrolled blood sugar, then this glycemic control is very essential for the healing of the wound, where the healing of the wound would respond in accordance or proportionate to the glycemic control in that person. That is Pradhana Prashama chikitsa. So this is how we apply it in our treatment setup. Having told this algorithm of the Shadkriyakala, I would quickly take you through the one or two disease examples, like how we go to apply it. I was speaking of the next three stages of the Kriyakala, that is the Purva Rupa Avastha, the Vyakta and the Veda Avastha. Now, Jwara is a very good example to quote because the elaborations that are given in the chapter of Jwara are so elaborate that it is applicable for each and every disease that follows in the treatises. And Acharyas himself told that if you follow the sutras that are explained in Jwara, you can handle any disease that follow in the next chapters. Therefore, we all know that Jwara is kept as the first chapter, and a lot of priority is given in the description and elaboration by all acharyas almost in Kayachikitsa. Now here I would like to draw your attention where in the Kayachikitsa we find, very rarely found in the text, but in Kayachikitsa we find the Chikitsa that is mentioned in the Purva Rupa Avastha in itself for Jwara. And that too, both the Samanya, we teach our students Samanya Purva Rupa and Vishishta Purva Rupa. And both of these informations of treating Jwara in its Purva Rupa by considering Samanya Purva Rupa and by considering Vishishta Purva Rupa is elaborated by Charaka and Shushruta respectively, where the Purva Rupa Chikitsa told by Charaka is Apatarpanam, Langanam or Apatarpanam, Lakvashanam, Apatarpanam va. This is what is told by Charaka. He tells about the Samanya Purva Rupa Lakshanas and then he tells about the Samanya Chikitsa in the Purva Rupa Avastha. And now to connect it to the Samprapti Vighatana, how does it touch to the Samprapti? Purva Rupa, we understand it is the fourth stage of the Kriyakala in the Kriyakala. And how it touches the Samprapti, why do we have to give Lagu Ashana or Apatarpana Chikitsa? Jwarasya Amashaya Samuttattvat. So I had not touched in the Samprapti Ghatakas. We also have the four sthanas, the Utpatti sthana, the Sanchara sthana, the Adhisthana and the Vyakta sthana also incorporated in the Samprapti Ghatakas. Now here we see how the Samprapti Ghatakas are touched and the Chikitsa is intended to do the Vighatana of that Samprapti through the Amashaya, which is the sthana for the Jwara, by adopting Langana. Now, when it comes to Shushruta, he is the person who adds on an extra link by mentioning the Lakshanas for Vataja Jwara, Pittaja Jwara and Kaphaja Jwara. We know that Jramba Dikyata, then Nayana Daha and Aruchi Chadyadi for Vata Pitta Kapha respectively. And he is also the person to mention about the Vishishta Chikitsa Sutra for the Vataja, Pittaja and the Kaphaja Jwara after having identified their Vishishta Purva Rupa. So in that context, he tells for Vataja Jwara, this is referred to the Kevala Vata Jwara. Swachha Grita Pana is to be done to the person in the Purva Rupa Avastha if it is identified as Vataja Jwara Purva Rupa. Likewise, Bradu Virechana and for Pitta and for Kapha it is Prachardana. So the attention what I want to draw here is there are references of Chikitsa Sutras which are mentioned in the fourth stage of Kriyakala. Now for the fifth stage of Kriyakala, here I would not elaborate more because most of us know about Dosha Pachana, Upaya, Langana, Svedana, Kala, Yavagu, Tikta Karosa. I wouldn't go into that elaboration. But whenever we also know that Jwara is a Santarpanotta Vyadhi as well as an Apatarpanotta Vyadhi. There are very few diseases who have a mention in both. Jwara is an extraordinary condition. Now, when it is a Santarpanotta Vyadhi, we have the understanding of its association with Ama, and if it is in the Apatarpana context like Kevala Vataja Jwara, Abhigataja Jwara and all those varieties of the Agantu Jwara, the Jirna Jwaras where it is a Nirama Jwara, the approach of the treatment. Now this is an algorithm here for the respective disease that I'm talking about, and that algorithm what you saw in the previous slide was algorithm for the fourth stage of the Kriyakala. Now, here, if we identify it as a Samajora, we have the Dosha Pachana Upayas, and we know the elaborations of the Dosha Pachana Upaya. Like if at all it is a Niramajvara, which is a minimal fraction, though we have to skip the dosha pachana upayas that are told by acharyas, and directly we need to go into the brahmana or the santarpana lines of management like gritapana, kshirapana, mamsarasa prayoga, and the other bahya upacharas that are mentioned. Whereas if it is a case of a samajvara, all these modalities of treatments are adopted for converting the sama to a nirama condition, and then still if the jvara exists, we take it in the management of Gritapana, Kshirapanadi, which usually may have a situation to be adopted in chronic fevers rather than acute fevers. Now, this is, I wouldn't elaborate on this slide, just to tell that how it starts with Langana, with the most of our diseases which have involvement of ama start with Langana, and we know that Jvara is a Rasa Pradoshaja Vikara. Now here, taking into consideration the Srotas, not only the dosha, not only the dushya, but even the srotas, the dushya rasa and the srotas, rasava srotas. Rasava, if we go into the pradoshaja vikara, chikitsa sutra, rasajanam, the treatment is langanam. So jvara is an example in rasa pradoshaja vikara where the treatment starts with langanam. So we are, what I'm trying to tell here is the individual gatakas of the Samprapti are taken into consideration for the Vighatana through the Kriyakala. Now, this is the shloka. I do not know how many are familiar with it, but it's a very beautiful shloka that tells about the Chikitsa Sutra overall in Jvara, irrespective of the variety of the Jvara, and it is quoted by Bhava Prakasha, right from the Jvarado to the Jvara Mukte condition. At every level, what is that phase and what is that algorithm that changes in the treatment is told by Bhava Prakasha. Jvarado Langanam Proktam, Jvara Madhye tu Pachanam, Jvara Ante Veshajam Dadyat, Jvara Mukte tu Rechanam. So that marks or enlightens about the different stages of the disease and what treatment to be followed in which stage of the disease is guided by this Chikitsa Sutra applicable for Jvara, irrespective of not going into the individual, because I will not be going into individual Jvaras like Sanipata Jvara, there is a Chikitsa Sutra, Vishama Jvara is there. Likewise, we are grossly taking up the Samanya Chikitsa Sutra and explaining it. Now, here Jvarado Langana would connect to what explanation we talked about in the previous slide to Dosha Pachana Upayas. And even in the Dosha Pachana Upaya, if you see, after the Langanas Vedana and Yavagupana, the Tikta Rasa Prayoga. So this Tikta Rasa Prayoga in the dosha pachana upaya of the Amajvara is a junction point between the conversions of the Sama to the Nirama condition, and that is why Charaka further elaborates Tikta Rasa or Kashaya Pana, depending upon the avastha of the Jvara, has to be made a selection. There are Pachana Kashayas, there are Shamaniya Kashayas. If the Jvara still has Ama within it, then follow the Jvara Madhye Pachana, go for Pachaniya Kashayas. If the Jvara has crossed that stage, go for the phase of Jvarante Veshajam Dadyat, make a selection of the Shamaniya Kashayas. That is how we demarcate. So this Tikta Rasa is a bridge between the Jvara Madhye Pachana and the Jvara Ante Beshaja, just by bringing about a difference in the selection of the Tikta Rasa based upon the Karmukata that is wanted and the bishop decides upon it. Next, Jvara Mukte tu Virechanam. Virechana, we do have the substantiation. Again, it connects with the Aramaka Dosha, Pitta, and Virechana is also a treatment that would get along with all the three doshas, with the Pradhanata of the Pitta dosha, which is exactly seen in Jvara. And the intention in the Mukta Avastha, this is with the concept of the Shesha Dosha Avastha in order to avoid the Punaravartana of the Jvara by the Shesha Doshas. Now, these things are what I have already explained, the initial two shlokas. Now, I would also, to complete the Kriyakala in Jwara, I would like to draw your attention towards this last point that I've highlighted as Veda, which is red in color. If you go into Shushruta Uttara Tantra, 39th chapter, you will have Upadrava Chikitsas being mentioned for individual Upadravas in Jwara. And that stands in accordance with the sixth stage of the Kriyakala. That was about Jwara. Kindly excuse me. I take the next example. I'm almost at a completion, a little bit on this one disease. You saw that the algorithm that I followed previously was of one pattern. This is to the attention of the teachers here. And this is another algorithm what I have followed in Panduroga. There are two different algorithms that I've kept forward. You can follow or make choices according to the descriptions that are available in the text and you are comfortable with. This is a very beautiful example of the Samprapti of Panduroga, where you can slice the shloka into the avasthas at different levels in the Pandu Samprapti and understand the different stages of the Kriyakala. Samudirnam Yadapittam Hradaya Samavastitam. That marks the Sanchaya. The Sanchaya is already understood, and the Pitta entering into the Hradaya, which is its Gauna Sthana from its Uppati Sthana, Ado Amashaya, marks the Prakopa stage of the Kriyakala. Vayuna Balina Chiktam Samprapya Damanir Dashaha. The movement of this dosha into the whole body through the Dasha Damanis marks the Prasara stage of the Kriyakala, where Prapannam Kevalam Deham, it moves throughout the whole body. Then Twang Mamsantara Ashrayam. That marks the Sthana Samshaya stage of the Kriyakala. And what it does further, it initiates the other Anya doshas as well as the Dushas. Twang Mamsadi Dushya, Pradushana of the Anya doshas and the Dhatus. The Vyakta stage marks with the hallmark that is Karoti Tat. Here Pandu Haridra Haridran Varnan Bahuvidans Tvachi. This description, it doesn't only relate to Panduroga, it is also related to the Kamala Roga and the Halimaka Roga, which are followed next as per the link that is shared through the Nidanartakara Roga of the Purva disease, the previous disease. So this shloka incorporates the Samanya Samprapti for Pandu, Kamala and Halimaka. Now we restrict to Pandu, so Pandu Varana becomes the Pratyatma Lakshana, and that is the Vyakta stage of the Kriyakala. Further in the chapter we have the description of the Asadhya Lakshanas of the Pandu, where there is Karibhuta Pandu, Shvetati Digdangataha, and that explains the Asadhyatva, Upadravas and Dirghakala Anubandhitva of the disease, which marks the Veda stage of the Kriyakala. Now, this is where we connect the treatment. I try to connect the treatment principles that are explained in the chapter of Panduroga by Charaka to the Samprapti that is told by Charaka. There are two shlokas of Samprapti that are explained, which are interlinked and to be understood together to get the entire meaning. Now, most of the changes that are told here are touching about the changes that happen by the vitiated doshas at the different dhatu levels. Doshaha pitta pradhanastu. Now, how the Samprapti Ghataka or the entity goes for a Vighatana by utilizing the Chikitsa Sutra in the Vyakta stage of the Kriyakala. That is pitta pradhanastu. That is why in the Chikitsa, Pandvamai, Snigdha Stichna, Urdhva Anulomikaihi. So, Urdhva Anulomana Chikitsa is told where the Pradhana dosha is Pitta. Panduroga is a Pitta Pradhana Tridosha. Now, Shaitilyam Tasya Dhatunam Gauravam Chopajayate Tato Bala Varna Sneha. Sneha Yeche Anye Api Ojaso Gunaha Vrajanti Kshayam. There is a Kshaya of Snehadi Ojo Dashagunas. Predominantly Sneha. Therefore, if we see into the treatment aspects, we have Panchagavyam, Mahatiktam, Kalyanakam, Matapiva, Snehanartam, Gratam Dadyat, Kamala, Pandurogina. So, there are a good number of Gritas that are mentioned, keeping into the mind we talked about Vradhi Samanai Sarvesham in the previous slides. This is where it is getting connected. The Sneha is given as a treatment for the Rukshatva or the Sneha Abhavatva that is seen in the disease. This Rukshatva is very clearly clinically evident and explained in the text also. Of course, Vataja Pandu, no doubt it is understood. Brat Bhakshana Janya Pandu also it is mentioned about the Rukshatva. If you go into the Asadhya Lakshanas of Pandu, Karibhuta Pandu is mentioned by Acharyas, where Karatva is Atyanta Rukshatva. The Ruksha Guna is evident in the Lakshanas of the Vyadhita. And again, therefore, because Vata is dominated by Ruksha, we have this Doshanusara Chikitsa Sutra, Vatike Sneha Bhuishtam, which connects with the Rukshatva or the Sneha Abhavatva. Then Paitike Tikta Shitalam. Here the dosha considerations are given and the Chikitsa Sutra, Dosha Anusara Chikitsa Sutra is told. Shlaishmike Katu Tikshnosham Vyamishte Sannipatike. Now, I would also like to draw your attention. If we all are aware that a lot of Loha preparations are told in the management of Pandu Kamala. Now, what presently, definitely we know through laboratory parameters that there is an involvement of the Rakta, the hematology test has got lots to add on. But these were the times where the laboratory investigations were not in vogue on those days, and it was the clinical findings that Acharyas had to rely upon. Then how did I identify? This goes with the adding on the Tulyartatahi Samanyam or Vridhi Samanai Sarvesham. That concept comes in here. Then how is that it was identified that there is a Loha Abhava in that Vyakti who is suffering from Pandu. See, if you see in the Sampraptim, so Alpa Rakto, Alpa Rakta, Alpa Medaska, Nissara, Shitilendriya. Why Varanyata is present? Because of Alpa Raktata. If we go into the gunas of the Rakta, Acharyas explain Loha Gandhitvam. The blood is identified by its Loha Gandha. Gandha is a guna. So that guna is present in this Loha, and that Parthiva Amsha Abhava, which is appreciated by the Acharyas, are instructed in the Chikitsa by adding on the Loha as one of the important ingredient in the preparations of most of the Shamana Aushadas that are enlisted in Panduroga. This is like how, this is my understanding how they must have identified the requirement of Loha in treating Pandukamala Rogi. Now, in conclusion, I would like to draw your attention through these text references, which I find are very important. This shloka already I made a mention of previously. Sarvasyamapi chikitsayam samprapti vinashanaya pradhanam prayojanam. Sanchayam cha prakopcham cha prasaram sthana samshrayam vyaktam vedyam chayo veti doshanam sa bhaved bishak. And Sanchaye aparata doshaha labantena uttarasu gatisu tetu uttarasu gatisu bhavanti balavattaraha. With these conclusions, which are the key highlights for a successful treatment by the bishop, considering the Samprapti Vighatana through the Kriyakala, Shadkriyakala, I end my talk, and these are the references. Thank you for your patiently listening and being with me online. Namaste, sir.
Thank you, madam, for your wonderful presentation. If anybody has any question, either they can write on the chat box or Dr. Manjula will conduct the question answer session. Dr. Manjula?
Yes, sir. I think there are no any questions in the chat box. Yes.
They may come in a few minutes.
If they are unmuted, maybe they can ask.
They can raise the hand so that we can unmute them. If it is
Shall I come out of this slideshow?
Yes, madam.
Okay.
Is there any question? You can write in the chat box.
This is a junction time. Today is Saturday, and it is the end hours of the working time. So we understand.
Actually, I have
understand
two
that.
students along with me sitting here, ma'am. I was just asking them. Had made them to listen. They're just thinking. I'll just give me 2 minutes, ma'am.
Dr.
If they have
Manjula
anything,
has
I'll
made
let them ask.
one sitting room, and there she has webcast your lecture.
I'll just a minute, ma'am. I'll just ask the students.
I had already also shared my email. I don't know if
Yes, ma'am.
anyone.
Yes, definitely, ma'am. If they come up with the questions later, I'll
Yeah,
ask
they
them.
can even later connect.
Yes, ma'am. Yes, ma'am. Sure. Yeah, Umar. You want us? Ma'am, a student, Umar, final year,
Yes,
he
yes.
has something to ask.
Yes, please.
Good evening, ma'am.
Good evening.
Ma'am, how to differentiate Samprapti Vighatana in Sanchara and Prasara?
Sanchara to Prasara, how to differentiate?
Yes, ma'am.
See, I made a mention on this previously. How to differentiate? If you ask me directly, I would all quote directly the reference of Shushruta in the 21st chapter. He has mentioned the lakshanas of the Sanchaya, of the Prakopa and the Prasara as examples for Vata, Pitta and Kapha directly. Now, to focus your attention in on a deeper understanding how to analyze, if you go into the Sanchaya Avastha, Tatra Stabda Purna Koshtata, right, for Vata.
Yes, ma'am.
Now, in the Sanchaya stage, it is the stage where the doshas are present in their swasthanas. Here, the swasthana is the Pakvashaya. So, Stabda Koshtata and Purna Koshtata, both of these are mentioning the dosha is present in its site, it is not moving, therefore it is Stabda, and it is filling in its own sthana, therefore there is Purnata of the Koshta. Then the same thing when you go into the Prakopa stage of the Kriyakala, it is suggesting movement. Koshta Toda Sancharana.
Yes, ma'am.
So from the Pradhana Sthana, when they are moving to their Gauna Sthana, so the secondary states, it is Gati Suchaka there of the Vatu, Koshta Toda. When there is movement, there is abdominal colicky pain. And Koshta Toda, Koshta Sancharana, it is moving. And then in the Prasara stage of the Kriyakala, it's a situation where the Vata will live its own Pradhana Sthana, its Gauna Sthana, and it will enter into the Anya Dosha Sthana. Yeah, that is Vata Pitta Sthana Gatasya. So the guidelines are in the Vata, Pitta and the Kapha, Sanchaya, Prakopa, Prasara Lakshanas of the respective stages of the Kriyakala that Shushruta has told in the Sutra 24.
Yes,
But
ma'am.
the reality situation is sitting in your clinic, it is like I wouldn't say you wouldn't get patients because there are so many patients that you also will be feeling. These are lakshanas in the person. You wouldn't be able to diagnose a definite disease and you'll be treating that. Such experiences are there. So these are the lakshanas.
Okay.
Dosha lakshanas are seen. And that is why we give the dosha pratinika chikitsas there.
Okay, ma'am. Thank you, ma'am.
Yeah.
Ma'am, one more student, final year again, Punya. It is, you want to ask directly or I'll ask on your behalf? she'll talk to you back.
Good evening, ma'am.
Good evening.
Ma'am, in some cases, like in Viprakrishta Nidana, there won't be any Sanchaya Prakopa Prasara. There'll be direct manifestation of diseases like Sthana Samshaya Vyakta Bheda. In such cases, how to differentiate, ma'am? What could be the significance of first three, ma'am?
Rather than Viprakrishta, even in Pradhanika, if you see the disease Pradhanika Hetus, there the disease manifests Pradhanika Hetu Visha, isn't it? As an example.
Yes,
Yeah.
ma'am.
More than Viprakrishta, Viprakrishta goes on a slow process. See,
Yes.
this classification, it's a classification of Nidana. Pradhanika, if I would like, the text mentions as Sannikrishta, Viprakrishta, Pradhanika, Vyabhichari, right? But
Yes, ma'am.
according to their manifestation of the disease, from the onset of the intake of the Nidana to the manifestation of the disease, I would rearrange it this way. Pradhanika Hetu first, Sannikrishta second, Viprakrishta third, and Vyabhichari fourth.
Vyabhichara at last. Okay.
Yes, at last, because that tells about the timeline between the Nidana Sevana to the manifestation of the disease.
Okay.
So, in the Pradhanika Hetu, the Hetu is so prabala, like when you observe on the exterior a patient, within no time from the consumption of the cause, the person would have already reached the Vyakta Beda Avasthas. That's why Visha is given as an example.
Yes,
You
ma'am.
don't have the time for an appreciation. You directly see the consumer poison is consumed and the person has symptoms immediately, right? Just excuse me, I'm cough irritating.
Yes, ma'am. Ma'am, can Abhigataja kind of conditions can also be quoted under this category, ma'am?
Yes, Abhigataja has an Agantu Karana. Coming back to your question, it is not that there is no Sanchaya stage. It is time.
Okay.
The Sanchaya stage goes so fast that it seems to be an Achaya Purvaka Prakopa. That doesn't mean that literally there is no Chaya. It happens. But the time taken for the Chaya Avastha is very minimal because of the strength of the Ketu.
Okay. Thank you.
Actually, they joined the session in the middle, ma'am. So sorry, I think you had to repeat the things.
No, I had not touched upon that question.
Okay.
It's a good question.
Yes. Thank you, ma'am. Thank you. There are no any questions in the chat box, ma'am, actually. And if any students come up with new questions, I'll mail it to you, ma'am.
Yeah, thank you. And thank you so much for the opportunity.
Okay.
Special thanks to Dr. Nitin Sharma, sir.
Yes.
And all the members of Vishwa Ayurveda Parishad team through Kayachikitsa Sambhash.
Yes, ma'am. Thank you very much, madam. On the behalf of Vishwa Ayurveda Parishad, I welcome you. I give a special thanks to you for this wonderful presentation, and all those who joined, they kept throughout the session. It itself shows that how beneficial it was for them. And now I also thanks our convener, sir, Professor J.S. Tripathi, sir, who is the professor in the BHU, and the co-convener, madam, Professor Mandeep Goyal, madam, who is from Jamnagar, and Dr. Manjula, who is the co-coordinator, and all our zonal coordinators also, and Professor Govind Sukla, sir, who is the president, Professor Mahesh Vyas, sir, who is general secretary, Professor Yogi Chand Mishra, sir, ordinary secretary, and Professor Anil Sukla ji, who is the Rashtriya Pramukh of the Shikshak Prakost of the Vishwa Ayurveda Parishad, and Professor K.K. Dwivedi, sir, and for his continuous guidance, and our Dr. Suren Chaudhary, sir, who is given the technical support for every Sambhasa. He create the Google Meet link and look out the technical matters for all that. And so we will end today's program by our Santipal. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadyani Pasyantu, Ma Kasyadu Bhag Bhave. Thank you, madam. Thank you for your wonderful lecture. It was very beneficial. Thank you.
Thank you, sir. Thank you.
Okay.
So I'll leave the meeting.
Yes, madam.
Yeah, thank you.